This is my first time being videoed, so please bear with me. I guess you have to hold both of these. So what does psychosocial mean? So the psychosocial aspects of transplant, basically that means how is transplant, how it can affect your family, how it can affect you, and how it can affect your overall, your daily patterns. So first I'll talk to you about the role of the clinical social worker. There are 3 clinical social workers with the kidney transplant team at Stanford. Next to me there's Sally Castillo, and we have a new addition, Jungmin Park, very exciting. So we have 3 clinical social workers. In the beginning we do, at your initial evaluation, we do a psychosocial assessment. We can provide recommendations after that assessment. We really want to get you to a place so that you're ready for transplant, and certain goals may need to be met before we're ready for such a transition. We can provide community referrals. We do a lot of education and support throughout the entire process. We do a self-management assessment. The more commonly known term is compliance. Stanford uses the word adherence. Self-management is the new word for this. I think it sounds a bit softer, but they all mean the same thing, compliance assessment. And the clinical social worker is present through the entire process. So from the time that you evaluate with us at your initial evaluation, through the wait time, through hospitalization, for the life of the kidney. Okay? So a little bit about the psychosocial evaluation at the beginning, just so we don't scare you off. There are very few absolute contraindications to transplant from a psychosocial perspective. So really, and we would let you know those if they came up. We really just want to get to know you better. We take a family history. We want to know what your current social system is about, because that's going to play a huge role in the transplant transition. We do a lot of education in the evaluation. As Tanya had mentioned, we have a 2-hour teaching session prior to your initial evaluation. We give you a lot of information. So as a social worker, I sort of want to understand what you absorbed, what you didn't. I want to sort of plug in the things that you might have missed, the main ideas. And we get that it's going to be a long wait time for some of us, and opportunity for furthering your own education as we move forward. But I want you to get those basic concepts in the beginning so that you're armed and ready to answer questions of Dr. Melcher when he comes in. We do a psychiatric history, a substance use history. We also want to know how much you know about your own illness. People who do the best with transplant are really involved and motivated. Excuse me. Excuse me. Because transplant requires a lot of action on your part. So people who know a lot about their illness and are well informed do very well, typically. And we also, again, we talk about your self-management, quote unquote. We also want to know what your expectations are with respect to transplant. A lot of people believe that transplant is a cure-all for a lot of issues, and we want just to make sure that you have realistic expectations about what transplant might be able to provide to you. So, this is my little joke. Marriage, babies, and transplant are all fabulous, but they are all significant life transitions. And what we know about major life transitions is that they carry the potential to cause stress, much like a baby when it does that. Stress does funny things to the brain. Stress can impact your interactions with people, your self-management, your self-care, your motivation, your perspective. And so we want to make sure that you're well informed about what this transition is going to look like. There may be a few bumps in the road. If someone has experienced depression or anxiety before transplant, they're more likely to experience this after transplant. A lot of things can come up for people after transplant. So these are some of the things that come up, and we'll talk more about them in a moment. Returning to wellness is an issue that sometimes comes up for people. Role reversal, you're going to have to rely on a caregiver. It can impact your family. Some people have to take time from work, caregivers and patients. There can be setbacks, disappointments, rehospitalization. There's a financial impact with co-pays, possibly. And medication side effects, and we'll talk a little bit about that in a moment. So first, with hospitalization. We may be calling you in the middle of the night, and we're saying, get here right now. And for the next 2 to 3 months, your life is going to be refocused on how to take care of this new little baby we've given you. So there's a sudden departure from your regular life pattern. Increase in stress. Hospitals aren't the best place to catch up on sleep. You're going to be so tired during the hospitalization. There's all of a sudden an increase in responsibility overnight and a decrease in independence. And on top of that, we give you medications that can cause mood swings. Not very nice of us. I got a thumbs up from someone who's done it twice. So who here has experienced prednisone? Okay. How fabulous is it? Yeah, it's not very fun. It's not very fun at all. Then after transplant, is when sort of you're learning how to live this new life, new style of living. It can affect family dynamics. All of a sudden you're independent. You may be used to having been on dialysis for many years, and all of a sudden you're free. People sometimes giggle when I say this, but there are some people who really have become accustomed to the dialysis lifestyle, and it's become a community of sorts. You get to know your neighbors on either side. They get to know their nurses and their techs, and you form some relationships, and all of a sudden that's gone. Adjustment to new daily patterns. There can be disappointments, rehospitalizations, again with the medication side effects. There's also something called caregiver stress. In the initial phase after hospitalization, you're going to be relying heavily on someone else for support, and that can put a lot of pressure on the caregiver. At Stanford, we actually have a caregiver, it's a very long title, Caregivers for Solid Organ Transplants. It's a support group, thank you, thank you. And I run it along with 2 or 3 other solid organ transplant social workers. So I have information on that for you. Oops, thanks. And then return to wellness. This may sound silly too, but I've heard more than once, they get this transplant and they think they're expected to perform, go back to work, reach all those goals, live, live, live. It can really be hard for some people to get used to that. Okay. So how can we help? How can we fix all this? Well, we can't. We can really just try to do our best to support you through that. Provide education. I think that's one of the strongest tools. And we provide referrals to community resources. So again, we're your social worker for anything transplant related, but for sustainable resources that you can access ongoing, we want to refer you to resources in your community. This might include, but not limited to, counseling, kidney organizations, I think are a good source of support. Transplant support groups. If you're on dialysis, your dialysis unit social worker will be most familiar with resources in your immediate area. I think this one is very helpful. Peer referral, and I heard someone speak about that at the beginning. If there's a peer program here, I think that's wonderful. A lot of my transplant patients have benefited from talking to other transplant patients, and same with donors. And we also have a transplant psychiatrist. His name is Dr. Jose Maldonado. He specializes in understanding how transplant and the brain can work together. How can it be affected by that? And if needed, we can access that transplant psychiatrist before or after the process. And also, before we go on to the next slide, that's fine, you can leave it there. I put together a list of resources for kidney patients that I've found helpful to my patients. And I'm going to put the stack right back there on the table with the other handouts, and please don't hesitate to pick one up. But I'll just briefly highlight some of them. There's an organization called TRIO. How many of us have heard of that? Great, great. So they have a wonderful support group that's run out of El Camino Hospital. TRIO, if you don't know, stands for Transplant Recipient International Organization. And there's a support group that once was run by Linda Smith. I think she's still doing it. And it's a very active group. It runs, let's see, once a month, second Tuesday of every month for an hour and a half. Oh, thank you. Well, so my handout says second Tuesday. Just know that it's second Thursday. It's definitely second Thursday? Okay. I've put the phone number on here as well, so she does encourage you to call before you come, so they just kind of know what to expect. So give that one a call if you're interested. I mentioned the caregiver support group at Stanford that's very helpful for specifically our caregivers. It's for caregivers. Prescription assistance. This can come up when there are lapses in our insurance, God forbid. There's a very helpful phone number that I found helpful. It's Partnership for Prescription Assistance. You can call this phone number, name all of your meds, and they can tell you whether or not there's a patient assistance program for that particular medication. A patient assistance program is through a pharmaceutical company. So, for instance, Cellcept. Is it Roche or Astellas that does Cellcept? Roche. So Roche has a program. If you have to meet certain income requirements, but you can qualify to receive free medications, and they review your status annually. But that can be very helpful if someone runs into problems with insurance coverage. There are very few resources for our non-citizens with respect to medication assistance, but one of the only ones that I found in the area is the Ability to Pay program at Santa Clara Valley Medical Center. Were you raising your hand? No. And then kidney organizations are another great source of support. Has anyone heard of National Transplant Assistance Fund, NTAF? Okay. Okay, good one. So this has been hugely helpful for a lot of my post-transplant patients. It's fundraising guidance. They guide you in learning how to fundraise and hold events for your own cause. And they have a little bank account, if you will, and the donors donate directly to that account. So it guarantees the donor that the funds are actually going toward kidney transplant-related costs and not to a trip to Europe. But they also have an expanded emergency grant program, and I've used this several times. Each of these resources are short-term solutions. They're there to bridge a gap, for instance, in insurance or in an emergency. So I've used the emergency grant program for a patient who was needing to come back and forth after transplant and was having trouble with the housing costs, the gas costs, and they were able to qualify for quite a bit of money. My coworker, Sally Castillo, got a grant for someone who was coming from Arizona, I believe, for IVIG? Nevada, for IVIG treatments, and was incurring tremendous amount of costs from travel. And they actually got some of their flights paid for. So that information is on this sheet, and you can also talk to any transplant program social worker, and she can guide you, or he, through that process. The Kidney and Urology Foundation of America has scholarships and award programs. There are 4. There's one for people who like to go to school, I think, under the age of 25. There's a separate scholarship for those who are over the age of 25, want to return to school or job training. And there are 2, I believe, merit or achievement award scholarships. So I'm going to put this, there are several more on here, but I'm going to put these, again, next to the door in the back, so please grab one on your way out. Yes?
A quick related question. Has Medicare extended transplant meds beyond the 3 years?
So no. No. Did everyone hear his question? Still, Medicare is only, so if you've obtained Medicare because you're on dialysis and then you have a transplant, you'll only have Medicare for 3 years post-transplant, and then it's taken away. So I think the ideology behind that is they think, oh, they're better. They can go back to work and get insurance through their employer. So that's, unfortunately, has not changed. If you've obtained Medicare because you're over the age of 65, you'll have that indefinitely. If you have Medicare because of another disability, you'll have it for the length of that disability. Sorry? As long as the government has the money. Be sure to collect that as you can right now. So needless to say, it's very important to have a nest egg. We never know what's going to happen with our insurance. And if our insurance, for whatever reason, lapses unexpectedly, we are responsible, the patient is responsible for $2,000 to $3,000 a month of medications. And if they can't access those, what happens to your transplant? Yeah. So it's a scary thing. So I think what I mentioned, NTAF, National Transplant Assistance Fund, it's been a wonderful resource for many of my patients in saving in anticipation for the post-transplant period. She's saved something like $8,000 so far.
Is there any particular group of people that's trying to improve the coverage post-transplant that's lobbying Congress or any body?
Do you? Okay.
There's legislation that's under study right now to extend that 3-year period.
That's fabulous. So what is your name?
I'm Jean Heisey.
Jean.
And I have polycystic kidneys and received a kidney transplant last year at Hopkins.
Okay.
So.
Okay. So did you hear what she said? Yeah. So the legislation in Congress right now being reviewed to possibly extend that 3-year wait or 3-year coverage time.
And that includes the National Kidney Foundation too. Is also lobbying.
Oh, great, great, good. Sure. So the importance of the support system, I just want to briefly review this. Transplant is never done alone. It's a major, major surgery, and you're not only going to need practical support, but emotional support as well. The caregiver is going to be helping the patient with three main areas: medications, transportation, and help in the home. And also, as I mentioned, emotional support is huge. As far as the caregiver goes, I've mentioned caregiver stress. That is a very real thing, and I encourage our caregivers to take care of themselves through that process. You do need to monitor the patient quite closely, but I encourage you to go for walks as well for yourself, know what works for you, because the process can be a bit stressful.
So back to compliance, where have you seen compliance problems in your recipients?
Did everyone hear his question? Where have I seen compliance issues in our patients? It happens. It happens. I think there's an adjustment period when people go onto dialysis. Depression, the rate of depression is quite high in the first year of dialysis. Depression,
Post-transplant compliance?
we've seen it. What are you looking for?
I'm trying to understand where, from a psychosocial point of view, compliance is a huge thing. It's
Mm-hmm.
a big part of your assessment.
Mm-hmm.
Right? So where have you seen the problem with compliance? Where's the compliance issues?
People sometimes have issues with compliance. The cases that I've seen it, sometimes there are disappointments, rehospitalizations, and patients can develop depression. Depression impacts self-care. I've also seen people go back to drinking. They've had a history of drinking, and when things get tough after transplant, they go to what they know to cope, and that will impact your self-care as well. Some people just don't want to be sick anymore. They get their transplant and they feel like, I'm better. That's not as common. Our younger patients sometimes have problems with that. Okay. And it's always important to have your plan ready. Again, some of us may be waiting for many, many years, but there is always the chance that you could be called before your time. I think last year we did about 10% of our transplants were perfect matches. Is that right? About? Okay, 10 to 15%. One eval, and I'll just preface this by saying this is very rare. I did an evaluation. He got called 1 month after I did the evaluation. It is so fun. So we refer to it as the kidney lottery. The chances of winning our kidney lottery is better than the general lottery. So, play.
Is zero mismatch going to still be a criteria going forward for UNOS, or are they changing that?
So our region is changing, that we won't take zero mismatches from outside the region, but we will do within the region zero mismatch.
It's going to affect your disease versus living donor programs, right? Quantities of both will change.
Possibly, but it has more to do with trying to be fair with allocation of organs to pancreatic recipients.
Okay, so what I was going to say beyond that is my point is always have your plan ready. It's kind of like waiting for a baby. You kind of know when it's going to come, but you don't know when exactly. So you have your bag in the closet, you know that Aunt Susie's going to take the kids, and your employer knows that you're going to disappear for about 1 to 2 to 3 months when you get that call. So I'll just do this very briefly because Dr. Melcher will address this, and Tanya already did as well. Living-related and unrelated donation. We only do transplants between people who have a significant relationship already established, or between the patient and a family member. Confidentiality is a huge deal to our transplant team. Our donors are very important to us at Stanford. We're very protective of them. We want you to feel, the donor, to feel completely safe at any point in the process to express fears, concerns, disgust, anything. So they have a separate nurse, a separate social worker. There's also an independent living donor advocate who's going to check in with the donor periodically to make sure that that person is feeling comfortable with the process. At Stanford, the process of speaking to someone about donating an organ can be an awkward one to have. And we as social workers talk in the initial evaluation to patients about that on various ways to broach that topic. Some people don't feel comfortable with the one-on-one conversation, so we have a general letter we can send out if people would like that. They would give us names and addresses of people they'd like it sent to, and we send a letter that goes something like this. Dear Aunt Sally, so-and-so came in for kidney transplant evaluation, period. A kidney from a deceased donor lasts this long. A kidney from a living donor can last twice as long. If you'd like more information, please call us at this number. So we have that as an option too. So as we wait, I think the only upside to this wait time is that we have time to educate ourselves. I think that's the most important thing in terms of preparing for transplant. Again, maintain your caregiver plan. Make sure that that's ready to go. Keep us in the loop. Communicate with your transplant team. It can feel like maybe maybe I'm no longer on the transplant list. It's been 4 years, and it can feel like that. But really, we want to hear from you. We want to know about updates to your medical and psychosocial situations. And if needed, it can be difficult on dialysis or not. Access support and counseling as needed. And know what works for you. In challenging times, where do you go for support? Any other questions? Okay, so please remember to pick up a resource sheet on your way out. They'll be at the table in the back. Thank you. Thanks.